Hi all, today we are going to discuss about cross trial, so which is a chemoradiotherapy for esophageal cancer followed by surgery study, which mainly compare neoadjuvant chemoradiation followed by surgery versus surgery alone for esophageal and gastroesophageal cancer. So for a locally advanced esophageal cancer, the effect of tri-modality therapy, which is nothing but chemo, RT and surgery in well-selected patient populations appears to be significant. So this was emphasized by the cross trial, and this trial enrolled an impressive 368 patients during 4-year period, and 366 patients were included in the final analysis. The surgery alone group consisted of 188 patients, whereas 178 underwent trimodality therapy, that is chemoradiation followed by surgery. So in this, majority 75% of patients had adenocarcinoma and 22% had squamous cell carcinoma. So this is very important. The chemoradiation regimen preferred is 5-week course of carboplatin and paclitaxel administered concurrently with radiation therapy at a dose of 41.4 gray given in 23 fractions, which is given 5 days a week. So this esophagectomy was performed within 4 to 6 weeks in the treatment group and immediately after randomization in the control group. The R0 resection was higher in the trimodality group, so which is 92% versus 69%. The confidence interval p-value is less than 0.001. So patients undergoing trimodality therapy with a squamous cell carcinoma experienced a complete pathological response, significantly more than patients with adenocarcinoma. Expectedly, nodal positivity was higher in patients with surgery alone compared with trimodality group. So at a median follow-up duration of 45 months, that is almost 2.5 years, patients receiving the trimodality therapy had significantly longer median overall survival, 49.4 months, than did patients undergoing surgery alone. So cross trial chemo, RT, surgery, trimodality therapy, which is summarized in the table. The chemo given carboplatin with paclitaxel 41.4 gray in 23 fractions 5 days a week, and the pathological complete response is 29%, R0 resection 92%, 69%, and 5-year overall survival is 47%. But the trimodality therapy did not significantly benefit patients with adenocarcinoma histology in the initial analysis. In subsequent study with longer follow-up, the survival benefit of trimodality therapy SCC1 adenocarcinoma was confirmed, and this benefited the patients. Another very important trial called as Medical Research Council trial in a phase 3 study by UK, patients with locally advanced esophageal cancer randomized to chemo plus surgery versus surgery. This trial includes 802 patients randomized to receive chemotherapy plus surgery versus surgery alone. The survival benefit with a follow-up duration of 6 years with a 5-year survival rate of 23% with chemo plus surgery and 17% with surgery alone. Both adenocarcinoma and SCC patients experienced the benefit. There is another commonly referenced trial is which demonstrated better survival advantage and better R0 resection. The rate of neoadjuvant chemo and surgery or surgery alone was Medical Research Council adjuvant gastric infusional chemotherapy trial, which is MAGIC trial by Cunningham. So MRC trial shown that chemotherapy and surgery, which include 802 patients. So in that, chemotherapy given cisplatin 5-fluorouracil and median survival is 17%, in case of bimodality therapy, and surgery alone 13 months. Whereas in case of MAGIC trial, bimodality therapy confers 5-year survival is 36% and surgery alone confers 23%. The MAGIC trial mainly includes adenocarcinoma and chemotherapy that emphasized is epirubicin, cisplatin and 5-fluorouracil. So there is another one trial called as RTOG8501 trial. This trial includes a bimodality therapy of chemoradiation versus radiation alone by Heskovic and colleagues. So patient with esophageal SCC or adenocarcinoma could be cured with bimodality therapy alone. To improve the outcomes, researchers attempted to increase local regional disease control rates in subsequent intergroup. This trial, RTOG9405 trial, by modifying the intensity of radiation therapy to high dose 64.8 gray given concurrently with chemotherapy, but the toxicity and treatment related deaths were worse in the high dose radiation therapy group. Hence, the study established the 50.4 gray used concomitantly with chemotherapy is both neoadjuvant and potentially indefinite dose. So a very important point is studies have been published comparing the preoperative chemo versus preoperative chemoradiation. So in a randomized trial with adenocarcinoma of esophagogastric junction, trimodality therapy, chemo RT surgery had significantly higher pathological complete response rates and higher probability of tumor-free lymph nodes compared to induction chemo. Additionally, trimodality patients had much higher survival at 3 years compared to induction chemotherapy patients. But these results did not meet statistical significance. So, a meta-analysis which includes 24 trials and 4,188 patients on survival after neoadjuvant chemo or chemoradiation for resectable esophageal carcinoma provided strong evidence of survival benefit of multimodality therapy versus surgery alone. The result suggested the reduction in mortality of the trimodality therapy compared to induction chemo, but this did not meet statistical significance of p-value 0.07. And Murphy and colleagues subsequently showed the surgical resection and tumor differentiation were the only independent predictors of survival in a retrospective analysis. So patients who have received a bimodality therapy for esophageal cancer continue to suffer from the fear from that the disease may recur, either as a loco-regional or distant metastatic recurrence. The purpose behind the periodic surveillance of patients who completed the definitive bimodality therapy to implement a salvage therapy for loco-regional failure. Hence, as per NCCN guidelines, the researchers should consider observing patients every 3 to 6 months with clinical, endoscopy, and variety of imaging studies. This strategy is costly and anxiety-provoking. More than 98% occur in the first 36 months, so most of the researchers suggest vigilant surveillance during this first 36 months after bimodality therapy to potentially catch recurrences early enough to render salvage surgery a feasible step. The one cross trial is mainly for locally advanced esophageal carcinomas, but this trial still left many questions unanswered about the treatment strategy for loco-regional esophageal carcinoma.